Do you suffer from gas and bloating, diarrhea, constipation, acid reflux, or other digestive issues? Well, if so, you are not alone. 74% of all Americans suffer from digestive issues, and 15% actually have diagnosed irritable bowel syndrome. This is the second leading cause of missed work. Digestive issues can interfere with literally every aspect of your life. You may be less likely to spend time with friends. You are less likely to be in an intimate relationship. You may not have a regular exercise routine because you don't feel well. You can even have fear of going to restaurants and fear around certain foods. These things can interfere with your confidence levels. Digestive issues, though, don't have to be something that you have to live with. They are something that you can fix. Hi, I'm Dr. Berzin, and I'm the founder and CEO of Parsley Health. We're the only ones who focus on getting to the root cause of disease and helping you live your healthiest life. It's not just about managing symptoms, and it's not even just about treating disease. It's about helping you transform. And we have the data to prove it. 92% of our members with digestive issues massively improve their symptoms. 48% improve within just 60 days. Our members across the board spend 86% less on prescription drugs, and our members see far fewer visits to specialists because we take care of the real problem. I'd love to tell you a story of just one of our thousands of members who resolved their digestive issues. I'm thinking of a woman named Carolyn who was in her early 40s. She was a film producer, and for about 20 years, she had been dealing with gas, bloating, digestive discomfort, and intermittent constipation and diarrhea. She'd actually just come to think that this was just normal, and she tried different diets and she tried different supplements. She'd gone to a GI doctor, she'd gone to a primary care doctor. Literally no one had helped her. Everyone had given her symptom solutions, not root cause solutions. So when we started to work with her, we had to dig deep. We had to go back to the root cause. First, we talked to her about her history, her life story. When did all of this start? Well, it turns out that a lot of these issues started 20 years ago when she had had a lot of antibiotics for a number of sinus infections she'd been getting over a period of time, and when her diet had been really bad in college. So we started to unravel the issue and unravel the real story behind her digestive issues, which had then spiraled and snowballed over the years. We then moved to testing, and we did a full 360 holistic review of her body. We looked at nutrient levels, inflammatory markers, cholesterol levels, autoimmune conditions, everything that we needed to look at, including specialty testing that looked at how her gut was functioning, from stool testing to breath testing. We even looked at genetic testing and understood that she might have a higher likelihood of having certain types of food sensitivities. So after digesting all of this incredibly detailed and advanced data, we then came up with our plan. And our plan wasn't just another medication. It wasn't just another pill. We actually addressed her entire lifestyle, her diet. We used pinpointed professional grade supplements to address her condition. And we gave her a plan that over 90 days put her condition completely into remission and absolutely resolved all of her digestive issues. She was blown away. She honestly didn't think it was possible because she had felt like, oh, for 20 years people have been trying to solve this problem. But no one had looked at it the way that we did. No one had looked at it the way that Parsley Health does routinely for every single one of our members. And because of that, she got to feel like she was in control of her life again. Our approach to care at Parsley Health and everything you're going to learn today in this course is packed with evidence-based research, all of which has been approved by our team of board-certified doctors. Let's dive in. When it comes to digestive issues, other doctors tend to treat symptoms, and they treat them often with unnecessary or unhelpful prescriptions, or they write symptoms off as untreatable and something that's just normal, something you have to live with. At Parsley Health, we take a very different approach. We actually uncover the why of how you're feeling and address what's causing your digestive issues or IBS so that we can get you back to feeling your best sustainably. At Parsley, there are 5 major ways that we help our members tackle digestive issues. But before I dive into the how, let's talk about the common signs of digestive issues and also irritable bowel syndrome and the why these things can happen. So what is irritable bowel syndrome and how do you know if you have it? Well, IBS is a little bit of a problematic term because it's kind of an umbrella term to describe a variety of symptoms. You could have some of them or you could have all of them, and you could still be labeled with this label. These symptoms include abdominal pain, bloating, cramping, gas, diarrhea, constipation, thin stools, nausea, mucus or fat in your stools, and even changes in your bowel frequency. Again, 74% of all Americans have chronic digestive issues, and as many as 35 million are said to suffer from irritable bowel syndrome. Now, it's also important to recognize that IBS and digestive issues can affect things beyond the gut. Now, we know that the gut and the brain are deeply connected. We know that the microbes in the gut, the microbiome, the bugs in the gut, make things in their course of their day. They make metabolites that are absorbed through the gut and can affect the brain. We also know that the gut and the brain are connected through two nerves called the vagus nerves from the brain all the way down to the gut, and that the vagus nerves control the motility or movement of our digestive function. So for some people, they have symptoms like anxiety, depression, brain fog, and these things go along with their digestive issues. So don't just think that your digestion just affects your digestion. It actually can affect everything. Now, the truth is digestive issues don't have one single cause. There are multiple causes. It's important that you work with someone who can help you figure out the root cause of what's causing your symptoms. Each person is unique, and in this section of the course, we're going to cover the most common causes that we see at Parsley Health. What's so incredible to me is that no matter what the cause is, it's almost always treatable. So when we get to the root cause, that's the way that we unlock the door to understand how we can resolve these symptoms for good. Now, the first common cause that we see of digestive issues at Parsley Health is stress. This doesn't mean that it's all in your head. In fact, it's very much in your body. We are designed this way. We respond to external stressors or even stressful thoughts that we might have with neurohormonal changes in the body that are natural. What happens is you turn on something called the sympathetic nervous system. This is your fight or flight side of your nervous system, your run away from the lion side of your nervous system. And by design, when that's turned on, your digestive system turns off. And when the natural movement and secretions of your digestive tract slow down or turn off because your nervous system is telling you that it's not time to digest, if that's happening chronically or over and over again, that's when you start to see dysmotility or imbalances in the way the gut moves, which lead to gas, bloating, constipation, and diarrhea, because essentially your digestive system is going off and on in fits and starts in a way that it's not supposed to. Now, this can be true stress, external stress, but this can also be mental stress. Even a negative interpretation of an emotion can cause this. And this can cause short-term issues with your digestion. We've all had those butterflies in the stomach reaction, right? But this can also cause long-term changes in how your digestion works. The second most common cause of digestive issues that we see all the time at Parsley Health, and this is not just a handful of people, this is a lot of people, myself included, are undiagnosed or unidentified food sensitivities. And these food sensitivities can go often undetected by doctors who aren't thinking about them and looking for them. Now, there are food allergies, right, where you get an allergic reaction like hives and itching and swelling, and that's an immediate reaction, but you can also have something called food sensitivities, where these sensitivities lead you to not digest foods well, or they lead you to have longer term or more slow burn types of consequences from eating these foods. Now, the specific foods we see, well, there's quite a big list of them. It includes dairy, wheat, gluten, which is a protein in wheat, citrus fruits sometimes, beans and legumes, and then there's also refined carbohydrates and sugars, which can really do a number on people's stomachs. Or there's a specific type of fiber called FODMAPs, which we'll talk more about in a little while, and these can be poorly absorbed in the digestive tract and lead to some of your symptoms. In fact, FODMAP intolerance is present in at least half of people who have diagnosed irritable bowel syndrome. So the third common cause of digestive issues in IBS are changes, negative changes in the composition of bacteria in the gut. There are trillions of bacteria in your digestive tract, and we need these guys, okay? They're incredibly important for our health. There are 6 pounds of bacteria in your gut. And when we have certain habits or certain things happen to us over the course of our lifetime, we unfortunately get more inflammatory bacteria and we get less of the good bacteria, lactobacillus and bifidobacteria, that help balance our digestion and help our gut work. We at large, the royal we, have done a number on these bacteria and really destroyed a lot of the good guys while feeding the bad guys. So how have we done that? Well, there's 3 major ways. First one, diet high in sugar and refined carbohydrates. We were not meant to eat these foods routinely, and these feed the growth of the bad bacteria, leading to something called dysbiosis, which is a fancy word for imbalance in the good and bad bacteria in the gut. Okay, so when you've had a high carb, high refined carb sugar diet, you're gonna have imbalances in the gut. That could be causing some of your symptoms. The second one is lack of healthy fibers. So fibers can be an irritant, but they can also be helpful and important for growing the good bacteria population. So we need those healthy fibers that bind toxins, improve gut motility so that we don't get overgrowth, and feed the healthy bacteria. The third reason that we've really hurt our microbiome or our bacteria in our gut is the overuse of antibiotics. And it's not even just antibiotics, although those are a big one. One round of antibiotics can essentially wipe out a lot of the good bacteria in your gut if you just take them for 7 days. And when we think about how many antibiotics we've had over our lifetimes for most people, wow, it's a lot. So we've really done a number on these bacteria. It's also over-the-counter medications that you may be taking on a regular basis. These also affect our microbes. And oftentimes it can take months, up to 6 months, for our gut bacteria to fully recover after a round of antibiotics or after a round of other types of medications. So when these things happen, what happens? Well, sometimes it goes so far that we develop something called SIBO, small intestinal bacterial overgrowth, which is an overgrowth of certain types of bacteria in the upper intestine. And this can really lead to a lot of gas, bloating, acid reflux. And we're going to talk about how we address that later. Now, the fourth and final cause of digestive issues that we're going to discuss today might not be external factors like stress or antibiotics or even what you're eating. It might actually be your genes. So at Parsley Health, we routinely do genetic testing and genetic evaluation to understand how your genes are affecting your health today and long term. Many of you may have heard of something called celiac disease, which is a genetic intolerance to gluten. Gluten is a protein in wheat. 1% of the population has celiac disease, and 97% of that is undiagnosed. That means that 1 out of every 100 people is walking around with celiac disease, and they don't even know it. We see it go undiagnosed all the time at Parsley Health, and that's why we routinely run these genetic screens, because oftentimes people can simply understand their genetics and then clear up one of the top reasons they're suffering from things, including digestive issues, but also that are much wider ranging. Now we get to the good stuff, your 6-part plan for healing your digestive issues for good. Step 1 is testing. We have truly entered the era of personalized medicine, but what does that mean? Well, it means that we have advanced diagnostics that we can use to understand what's going on with you that's very specific to you, and that way we can tailor and personalize your treatment plan to your needs so we can truly get to the root cause of your issue and solve your symptoms and diseases for good. That's how we work at Parsley Health. So if you have digestive issues, there are a number of tests that we may use to get to the root cause and understand what's going on. The first one is a comprehensive stool test. This is way beyond like a regular stool test or what a regular doctor would do. This is looking at a number of things, including something very important, which is to distinguish between digestive issues, IBS, dysbiosis, meaning imbalances in the good and bad bacteria, and something called IBD, or inflammatory bowel disease, ulcerative colitis, and Crohn's, which are much more serious autoimmune conditions, and it's very important to know which one you have by doing the appropriate testing. The other thing that stool testing can tell us is, do you have a parasite? I can't tell you how many people have just had an undiagnosed parasite going on for years, and sometimes fixing everything is as simple as making that diagnosis. The second type of test we do is called a SIBO test, or small intestinal bacterial overgrowth test. Now, before you get scared, it's a non-invasive breath test. You can do it at home. It's really easy, but a doctor has to prescribe it for you. And the crazy thing is, something like 80% of people with diagnosed IBS have SIBO, or small intestinal bacterial overgrowth. And there's a very specific plan that we're going to use if you have SIBO, and a very different plan we're going to use if you have dysbiosis or a parasite or Crohn's disease or ulcerative colitis. So if your doctor isn't doing these tests, they really don't even know what they're working with. Now, there are other tests that we do as well. We do genetic testing, which we can look at whether or not you're likely to have celiac disease, which is incredibly important to look at. Again, 1 in 100 people, 97% of them are undiagnosed. And then we also do allergy testing, food allergies. Some people are allergic to foods that they don't know about, and they're having a chronic immune reaction because they're eating those egg whites or those peanuts all the time. And even though they're not, blowing up in hives, they are in fact allergic to them, and it's causing inflammation. And then separately, there's food sensitivity testing, which is a different type of testing. It's a blood test that we can do to identify whether or not you've become sensitive over time to different types of foods that aren't allergies, but true sensitivities. Step 2 in our plan to get rid of your digestive issues for good is, of course, nutrition, right? Not shocking, but it's the bedrock of how we address digestive issues at Parsley Health. So the first thing that we need to start with is getting you on an anti-inflammatory diet. We need to take out the inflammatory foods, the trigger foods, and we need to figure out what they are. And no matter how good a test is, the gold standard in understanding whether you have an issue with a food is an elimination diet. You gotta take it out, and you gotta take it out really for at least 30 days. I see this all the time. People take out a food for a couple days or maybe a couple weeks, but they're kind of not that strict about it. And they're like, oh yeah, I tried cutting out that food and it didn't do anything. No, you didn't really cut it out for at least 30 days and then do a proper staged reintroduction. So that's what we work with you on at Parsley, and your health coach actually works with you on this. And that way you can be completely successful. The most common trigger foods, the one we see over and over again, are gluten, dairy, and sugar, refined sugars, refined carbohydrates. Now, for some people, the sensitivities go beyond that, and there are other things like corn and soy and certain types of fibers like FODMAPs that we have to remove to get to the root cause and also to help heal the system. It's really important that you work with a qualified provider on identifying which foods are not so good for you and which foods are. Now, we can't just be successful by taking things out, we also have to put things in. So we really work with you on making sure that you're eating a lot of the healthy foods, the plant foods, the avocados, the healthy fats, the clean protein, especially from clean sources of seafood. These things can really help correct underlying digestive imbalances by bringing down inflammation. The third part of the plan to resolve digestive issues for good is around supplements and medications. Now, we can get a lot done through testing and food and nutrition, but sometimes that's not enough. And so we often start people on something called a gut healing protocol. The principle of the gut healing protocol is to remove, replace, reinoculate, repair, and relax or rebalance the gut. This is a functional paradigm for how we reset the gut action. Now, sometimes we can do this with supplements, and sometimes we need to do it with prescription medication. So there is a role for, believe it or not, antibiotics and sometimes antiparasitics that are prescription that a doctor can prescribe. And what we find at Parsley is that oftentimes you really need both. Sometimes we see GI doctors all the time giving somebody 10 days or 14 days of an antibiotic and being like, you're done, it's good. And what we find is that it always comes back. And we see people coming to us over and over and over again. I saw a gastroenterologist, or I saw my primary care doctor. They gave me 2 weeks of antibiotics. They told me everything would be fine, and it wasn't fine. Why? Because they didn't do the testing, they didn't address the nutrition, and then they didn't use supplements in conjunction with prescriptions to make sure that we have a sustainable system. So here's what we do when we try to start with remove. Remove is about sometimes antibiotics or sometimes just high quality herbal antimicrobials. These are like herbal antibiotics. And in Johns Hopkins University research, the herbs have gone head to head with the antibiotics and have done just as well, if not better. So it's important that we realize that supplements are powerful tools. They're not to be messed around with. They have to be used in the right way, and you have to use quality professional grade supplements. Don't just go buy stuff off the shelf and expect it to solve your problem. I guarantee you're wasting your money. The next thing we want to do is replace. So replace is about often adding in digestive enzymes. Now, when we're chronically stressed, as many of us are, we actually shut down a little bit our digestive function and the secretion of our digestive juices, which means that we're not putting those enzymes in and we don't break down our food very well. Well, you all know if you don't digest your food, your digestion's going to be a mess, right? So we add in digestive enzymes. The next thing we'll do is reinoculation. So we use the Parsley Health Probiotic or sometimes very specific probiotics, depending on what's missing in your gut, to reinoculate and help support the resetting of the microbiome in your system. The fourth thing we do is repair. So sometimes through inflammation, through gluten exposure or other toxin exposure, things like alcohol, ibuprofen, there's a lot of stuff out there that really messes with the lining of the gut, and this powerful lining needs to be healthy and intact for you to have good digestion. And so we add in something called L-glutamine, sometimes aloe extracts. There's a few different things that we can use to help heal and repair the lining of the gut. And then the last thing we do is relax or rebalance. So we want to give the gut lots and lots of healthy nutrients. At Parsley, we tend to use our Parsley Rebuild Protein Powder, which has a multivitamin and a lot of really wonderful anti-inflammatory nutrients in it, all in one. It's really delicious. I had one today. And it helps totally rebalance and relax the gut. So that's our 5R protocol. And again, sometimes we also add in prescription medications because sometimes you need just one, sometimes you need both, but it's important to work with a provider who understands the whole picture. The fourth part of our personalized plan is exercise. That's right, move it or lose it. And you're gonna say, what does exercise have to do with my gut? Well, if you don't move, then you will be constipated. If you are chronically constipated, then you will cause overgrowth of bacteria in the upper gut, and that could be the root cause of everything. So If you're not moving at least 150 minutes a week, which is what research shows is ideal as a minimum, not as a maximum, as a minimum for the human body, that might actually be the root issue in your digestive issues. So please start moving. And we give you a personalized protocol for exercise at Parsley that not only gets you moving and sweating and getting the gut stimulated, but also helps relax you. So things like yoga and Pilates can help relax the gut too. And we know that that gut-brain connection is also taken care of through exercise. The fifth part of our plan is positive mental health practices, right? We learn how to tie our shoes and brush our teeth, but we don't learn how to take care of our minds. So it's incredibly important. We described earlier the connection between the brain and the gut. The enteric nervous system, there are 500 million neurons in it. That's more than the number of nerves in your entire peripheral nervous system. We have truly a second brain in our gut, and we need to talk to that brain. So we teach deep breathing practices, meditation practices. They are part of your prescribed protocol at Parsley Health from your doctor. Meditation for at least 5 to 10 minutes every day and a mindfulness-based stress reduction therapy have both been shown to improve digestive health. And now the sixth part of your plan is lifestyle modification. So Twiggy here is really good at this, but it's important to laugh and have fun and to get outside and move. And so I have 2 rescue dogs at home and I walk them every day. And as much as I sometimes am not ready for that at 7 in the morning, it gets me out of my head, and it's part of the lifestyle that I lead to keep my digestion healthy and moving. Some other things that you can do, and Twiggy agrees, are to first eat mindfully and slowly. Often people are eating too fast, not chewing their food. This actually interrupts our stomach's ability to fully digest our food and our digestive system's ability to fully digest as well. Okay, Twiggy, you done? The next thing that we want to do is hydrate, right? So a lot of people are chronically dehydrated, and as a result, they're constipated, their gut isn't able to move well. 2 full liters of water a day with fresh lemon juice, that's what I put in mind to get myself to drink it and also to help it be absorbed well. And then the third thing that we teach people is to really reduce that alcohol consumption and that caffeine consumption. These things are diuretics. They affect the gut microbiome and they affect gut motility, and they can often lead to chronic dehydration, which is something you have to work a bit harder to recover from. So now that I've walked you through our approach to healing digestive issues, I want to illustrate this with a couple of stories of some of our real members who've experienced dramatic transformations in their gut health by following this method. So first we have John. He was about in his mid-50s, working in finance and eating what we would call the standard American diet, or SAD. So a lot of refined carbs, a lot of unhealthy fats, drinking a little bit too much alcohol, and definitely eating too much sugar. And for years, he'd been experiencing urgency and having to go to the bathroom really just immediately, which was really disruptive to him. He'd also been having gas and bloating and even diarrhea. And so he was really frustrated with this, and he sort of felt like, well, give it a shot. I've tried everything. I'll go to Parsley Health and let's see what you got. He was skeptical. But we first started by performing a few tests and looking at a full stool analysis, a 3-day stool test. We looked at a breath test. We also looked at celiac markers and genetic markers in his blood work. We did food allergy testing and we did food sensitivity testing. So we did the whole testing panel that we usually do. And we identified that he had imbalances in the good and bad bacteria in his gut. He did not have a parasite, but the bacteria was really off, and he had some yeast overgrowth from eating so much sugar for so long. And then he also had overgrowth of bacteria in his upper intestine called SIBO. And he just was inflamed across the board, and a lot of his standard blood markers also didn't look so great. So we simply started him on what we call our core eating plan at Parsley Health. This is a gluten-free, dairy-free, refined carb and sugar-free diet. It's really simple. It's not taking out every possible food group, right? But it's really the standard eating plan that we find is critical for most people to achieve optimal health. He followed this, and he also followed our gut healing protocol, which included a subset of supplements that we chose for him over about 3 months. It was hard for him, I'm not gonna lie. He had to work with his coach a bunch because he kept sort of falling back into his old eating habits, and then his symptoms would come back. But when we finally got him to stick to this eating plan and take the supplements for a couple of months, the results were phenomenal. He completely reversed and resolved all of his digestive issues. And by a year into working with us, he could barely remember having digestive issues in the first place. It was an awesome case. So let's talk about the Parsley Health membership and how we go about addressing these long-standing digestive issues, or even if you just have new digestive issues in the course of the membership, because it really is about getting to know you and working with you over time. That's where we see the success. So we start with your initial doctor's visit. This is a 75-minute visit. This is 5 times what most people spend with their general practitioner or primary care doctor in a year. We go through your entire life story. We go through your diet, your lifestyle. We know that 90% of your health is socially determined. The World Health Organization says that, which means what you're eating, how you're moving, your relationships, your environment. All of these things factor into your health, and we take in all of that data and talk to you about these factors in addition to your medical history. In this visit, we build your profile, we get to know you, we do a physical exam, and we get you started on your personalized plan. From there, we order in-depth diagnostic testing, including some of the tests that we've talked about today. Now, everyone's testing plan is different. The test you need and the test your friend needs with the same issues might be slightly different based on your history, based on your diet, based on the story that we hear, based on your physical exam. So we look at you across the board: inflammatory markers, hormones, nutrient status, heart health, and a lot of the in-depth testing that I've talked about today, including genetics, stool testing, breath testing, so we can fully understand what's driving your symptoms. From there, you meet with your health coach. So health coaching is awesome, and people who work with a health coach are 2 times as likely to achieve their goals as people who don't, right? It's one thing for me, your doctor, to give you a fancy plan. It's another thing for you to go home and do it, right? And so working with a coach helps you understand your plan, put it into action, figure out what to prioritize, and figure out how to troubleshoot if it's not working. Let's face it, we're all really busy. And so if we're gonna make some of these changes, it works so much better to do it with support. Throughout the rest of your membership, we'll do additional testing. We can't do every test day one, and sometimes we have to see how you respond to our recommendations before we decide on additional testing. We're constantly using new data to iterate on your plan to address the underlying issues. You also have numerous follow-ups with your doctor and your coach. You get over 200 minutes a year with your doctor, which is crazy considering, again, most people spend less than 15 minutes with their general practitioner every year. We check in on your progress, reestablish our plan, iterate on our plan, and make sure that you have the guidance and the support that you need to fix some of these issues for good. Now, we don't just see you, we also talk to you online. So we've built a state-of-the-art technology platform that gives you unlimited messaging with your doctor and your health coach and your entire team. This unlimited messaging is unheard of. Most people have to pay like 20 grand a year to a concierge doctor to be able to access their team directly throughout the year. But we offer this unlimited included in your plan because we know that questions come up. Other things that aren't related to your digestive issues come up. And as your primary care doctor, we can take care of anything from your headaches, your sinus infections, if you need a referral, if you need a recommendation for travel. We are that consistent relationship for you, and we are there for you throughout the year. Okay, so congratulations, you've gotten through the entire course, and now you are informed, you're empowered, and you are inspired to take control of your digestive issues or your IBS and to resolve them for good. And so if you're ready, if you're done with these symptoms, if you don't want to experience them anymore, if you're like, now is the time, I want to give you the opportunity to work with us at Parsley Health. We have clinics in Los Angeles, San Francisco, and New York City. And if you are ready to sign up for your annual membership, you can sign up now and get $150 off. That's 1 month free. So sign up to get your first month free at Parsley Health. It is an incredible value. And go to parsleyhealth.com/IBS for this special offer. It will only be available for 24 hours. So do it now. Don't wait. You have the information. You're ready to go. If you're ready to work with us, now is your opportunity. Don't just sit on these symptoms. If you've been dealing with them for 1 year, 10 years, 20 years, we have so many people who come to us who've been dealing with this stuff for 20 plus years. Now is the time. Find your local provider, or if you want to work with us at Parsley Health, take advantage of your special offer. Again, it's 24 hours and it's parsleyhealth.com/IBS. We look forward to working with you, and if we don't see you, please take care of these symptoms and in good health. Bye.